Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Shoulder arthroscopy. Introduction. Diagnosing and treating shoulder injuries may involve a simple surgery to look at the inside of the shoulder joint. If your healthcare provider recommends shoulder arthroscopy, the decision whether or not to have surgery is also yours. This program explains shoulder arthroscopy. It talks about the symptoms and causes of shoulder pain. It also explains the benefits and risks of the surgery. Anatomy. The shoulder joint connects the upper body to the arm. The bones involved in this joint are the following: the scapula or shoulder blade bone, the humerus or the upper arm bone. These bones are covered by special tissue called cartilage. The smooth surfaces of cartilage allow for smooth, painless movement at the shoulder joint. Ligaments connect the bones and help stabilize the shoulder. To allow your shoulder to move in all directions, muscles attached to the shoulder blade anchor themselves in the head of the humerus through special tendons. The combination of these tendons is known as the rotator cuff. The rotator cuff runs under part of the shoulder blade. Symptoms and their causes. Arthritis or inflammation of the joint causes the surfaces of the joint to become rough. Injury to the shoulder can cause cartilage tears. The ligaments may also rupture. Any of these conditions can cause severe shoulder pain. The pain may make the person unable to use the arm.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Patients may try medications such as aspirin or ibuprofen to decrease the inflammation in the shoulder. Physical therapy and occupational therapy may also help keep the joint as mobile as possible. Physical therapy can also strengthen muscles to prevent further injury. Injections of steroids in the shoulder joint may relieve symptoms. If the pain becomes disabling and does not respond to other treatments, then shoulder arthroscopy may be considered. Surgical treatment. Shoulder arthroscopy allows the surgeon to look inside the joint and determine the exact problem. It allows the surgeon to do some types of surgery. For example, the surgeon may be able to shave off a part of a cartilage that is loose and causing pain. The surgery takes 1 to 3 hours depending on your specific operation. The operation is done through a few small incisions in the shoulder area. The scopes needed to look and work inside the shoulder are inserted through these incisions. These scopes allow the surgeon to inspect the joint and take care of some of the problems found during the inspection. At the end of the operation, the small incisions are closed. You may be able to go home the same day. Risks and complications. This operation is very safe, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, headache. More serious risks of general anesthesia include heart attacks, strokes, pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they can cause shortness of breath, chest pain, and possibly death. It is extremely important to let your healthcare providers know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risks of this complication. Some of the risks are seen in any type of surgery. These include the following. 1. Infection, deep or at the skin level. 2. Bleeding, either during or after the operation. 3. Skin scars that may be painful or ugly. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. Organs around the shoulder area and close to the surgery may be injured, but these injuries rarely occur. Arteries and veins going to the arm may be injured. Nerves going to the arm may also be injured, causing arm weakness or decreased sensation. The pain may not be relieved by the operation. It may even be worse than before the surgery, but this occurs rarely. After the surgery, most patients go home the same day as the operation. You may also be given a sling to use for a short period after the operation. Physical and occupational therapy may be necessary after the operation to rehabilitate your shoulder.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Damage to the shoulder can happen in the bones, the cartilage, or the ligaments. For certain kinds of damage, arthroscopy can be a way to find out what kind of damage has been done and to repair some kinds of problems. Arthroscopic shoulder surgery is very successful in helping decrease your pain and improve your quality of life. This operation is very safe with good results, but complications may happen. Knowing about them will help you detect them early if they happen. Thank you for using Explain.